The paralysis of diaphragm. The paralysis of half of the diaphragm, one dome or hemidiaphragm, is because of injury to its motor supply from phrenic nerve. Phrenic nerve is the branch of cervical plexus. The injury to only one phrenic nerve does not affect other half because both domes are separately supplied by right and left phrenic nerves. This is the inferior view of diaphragm, this is the left dome, and this is right dome. Clinical features include paradoxical movement of diaphragm. Paradoxical movement is during inspiration and expiration. Abnormal movement of diaphragm during expiration. Instead of ascending the dome, the paralyzed dome descends, and during inspiration the paralyzed dome ascends. Now the next clinical is dyspnea, difficult breathing. People with respiratory disorders like asthma or with heart failure have difficulty in breathing. They use accessory respiratory muscles to assist the expansion of thoracic cavity. The accessory respiratory muscles are sternocleidomastoid, trapezius, and scalene muscles. These muscles expand the thorax. Now the next clinical is herpes zoster infection of spinal ganglia. The herpes zoster causes classic dermatomally distributed skin lesion, shingles. These shingles are agonizing painful condition. They cause agonizing painful condition. A spinal nerve ganglia having virus form shingles on respective dermatome. These are the shingles on the skin. These are eruptions, vesicular eruptions on the dermatome, and the nerve supplying this dermatome have its spinal ganglia herpes zoster virus. The features include varicella zoster is a common virus. Chickenpox causes herpes zoster virus. It affects mainly second thoracic nerve. The skin becomes red, vesicular eruptions appear. Pain follows skin eruption. Sensory neuropathy, pathological change in nerve. Weakness from motor involvement occur. Muscular weakness occur in same myotomal distribution. The treatment of herpes zoster virus. Vaccination confers protection against herpes zoster virus and is recommended for individuals aged 16 years and older. Now the next clinical is intercostal nerve block. Local anesthetic agents are used. Local anesthesia of an intercostal space is produced by injecting an anesthetic agent around the intercostal nerve. The location of intercostal nerve block is below the rib from superior to inferior. These are vein, artery, and nerve. Vein. These are intercostal vein, intercostal artery, intercostal nerve. The space between two ribs is intercostal space. This is the superior rib and this is inferior rib. From superior to inferior below the rib, this is intercostal vein, this is intercostal artery, and this is intercostal nerve. Anesthetic agent is given around the intercostal nerve. Use of intercostal nerve block. Patients with rib fractures. In surgery, intercostal nerve block is used after thoracic surgery. The word bullock means the bullock indicates that the nerve endings in the skin and transmission of impulses through the sensory nerves carrying information about pain or interrupted or bullock before the impulses reach the spinal cord and brain.